standing desks were supposed to save us. For years, we heard that sitting is the new smoking, that spending 8 hours a day in a chair was slowly killing us, increasing our risk of heart disease, diabetes, obesity, and premature death. The solution seemed obvious. Stand up, get a standing desk, alternate between sitting and standing throughout the day. And millions of people did exactly that, investing in adjustable desks, standing desk converters, and anti-fatigue mats, believing they were making one of the healthiest decisions of their working lives. But here is what nobody told you, and what I, as a physician who sees the consequences every single day, need you to understand. Prolonged standing is not the opposite of prolonged sitting. It is a different version of the same problem. And for many people, especially those over 50, standing for extended periods is quietly, systematically destroying the veins in their legs. Today I am going to explain exactly what prolonged standing does to your venous system, why standing desks can be worse than sitting for your vascular health, and what you should actually be doing to protect your legs, your veins, and your overall cardiovascular well-being. Let me start with the anatomy, because understanding how your veins work is essential to understanding how standing damages them. Your arteries carry blood from your heart down to your legs and feet, propelled by the powerful pumping action of your heart. But getting that blood back up from your feet to your heart is a completely different engineering challenge. The blood in your leg veins must travel upward against gravity, a vertical distance of 3 to 4 feet, without the benefit of a muscular pump pushing it along. Your veins accomplish this remarkable feat through a system of one-way valves spaced every few centimeters along the length of the vein. These valves open to allow blood to flow upward and snap shut to prevent blood from falling back down between heartbeats. The second critical component is the calf muscle pump. When you walk, your calf muscles contract and squeeze the deep veins of the leg, pushing blood upward through the valves like toothpaste through a tube. When you relax the muscles between steps, the valves close, preventing backflow. This walking, squeezing, pumping cycle is the primary mechanism that returns venous blood from your legs to your heart. Without it, blood pools in the leg veins, pressure builds, and the system begins to fail. Now here is the critical problem with standing desks. When you stand still, your calf muscle pump is essentially inactive. You are not walking. You are not contracting and relaxing your calves in any meaningful rhythmic pattern. Your legs are bearing your full body weight. Your veins are fully distended under gravitational pressure, and the blood inside them is stagnating. The venous pressure in your ankles while standing motionless is approximately 80 to 90 millimeters of mercury, nearly identical to the pressure while standing after sitting for a prolonged period. By contrast, the venous pressure during walking drops to approximately 20 to 30 millimeters of mercury because the calf muscle pump is actively pushing blood upward. This means that switching from a sitting desk to a standing desk without incorporating regular walking may actually increase the hydrostatic pressure on your leg veins rather than decrease it. You have traded one form of venous stagnation for another, and the standing version may be worse because the full column of blood from your heart to your feet is pressing down on the venous valves with the complete force of gravity. Over time, this sustained venous pressure causes the vein walls to stretch and dilate. The delicate one-way valves, which depend on the vein maintaining a specific diameter to create a tight seal, begin to malfunction. When the valves fail, blood that should be moving upward toward the heart falls backward and pools in the lower legs. This condition is called chronic venous insufficiency, and it is the beginning of a cascade of problems that range from cosmetically bothersome to medically dangerous. The first visible sign of venous damage from prolonged standing is the development of spider veins, small, web-like networks of dilated capillaries and venules that appear on the surface of the skin, typically on the calves, ankles, and behind the knees. Spider veins are often dismissed as a cosmetic issue, but they are actually a visible marker of underlying venous hypertension. They tell you that the pressure inside your superficial venous system is elevated, and where there are spider veins on the surface, There are often incompetent valves in the deeper veins below. As venous insufficiency progresses, the spider veins give way to varicose veins, enlarged, tortuous, rope-like veins that bulge visibly beneath the skin. Varicose veins are not just unsightly, they are symptomatic. They cause aching, heaviness, throbbing, and fatigue in the legs that worsen with prolonged standing and improve with elevation. They can cause nighttime leg cramps, restless legs, and a persistent sensation of tightness or pressure in the calves. And they indicate that the venous valves have failed significantly enough to create substantial pools of stagnant blood in the superficial venous system. But the consequences of chronic venous insufficiency extend far beyond varicose veins. The sustained elevated pressure in the leg veins forces fluid, proteins, and red blood cells out of the blood vessels and into the surrounding tissue. This creates a condition called venous stasis, a chronic inflammatory state in the lower legs that produces a characteristic set of skin changes. The skin around the ankles and lower calves becomes discolored, typically a reddish-brown color caused by hemosiderin, an iron-containing pigment released from red blood cells that have leaked out of the veins and broken down in the tissue. The skin thickens, hardens, and develops a woody texture, a condition called lipodermatosclerosis. The tissue becomes chronically inflamed, itchy, and fragile, and eventually, the compromised skin breaks down completely, forming venous stasis ulcers, open weeping wounds that are notoriously difficult to heal and can persist for months or even years. Venous stasis ulcers affect approximately 1% of the adult population and 3 to 5% of people over 65. They are painful, debilitating, and carry a significant risk of secondary infection, including cellulitis and osteomyelitis. Treatment is prolonged and expensive, typically involving compression therapy, wound care, and sometimes surgical correction of the underlying venous insufficiency. And they have a frustrating tendency to recur. Approximately 70% of healed venous ulcers will recur within 5 years if the underlying venous disease is not adequately managed. There is another serious consequence of venous stagnation that deserves special attention: deep vein thrombosis. When blood pools in the leg veins and flow becomes sluggish, the conditions are ideal for clot formation. The combination of venous stasis, endothelial damage from chronic pressure, and the hypercoagulable state that often accompanies aging and chronic inflammation, a triad described by the 19th century physician Rudolf Virchow, creates the perfect environment for a deep vein thrombosis to develop. A DVT in the leg veins can break loose and travel through the bloodstream to the lungs, causing a pulmonary embolism, a potentially fatal condition that kills approximately 100,000 Americans every year. Pulmonary embolism is the third most common cause of cardiovascular death, behind heart attack and stroke, and many cases occur without warning in people who had no idea they had a clot forming in their leg. The relationship between prolonged standing and DVT risk has been documented in occupational health research. Studies of workers in professions that require extended standing, surgeons, assembly line workers, retail employees, security guards, and hairdressers, have shown elevated rates of venous disease, including both chronic venous insufficiency and acute venous thromboembolism. So what should you actually do? The answer is not to go back to sitting all day. The research on the dangers of prolonged sitting is valid. Sedentary behavior is indeed associated with increased cardiovascular risk, metabolic dysfunction, and premature mortality. The answer is also not to stand all day. The solution lies in movement. Specifically, frequent transitions between sitting, standing, and walking. The optimal pattern for vascular health, based on the best available evidence, involves changing your position every 20 to 30 minutes. Sit for 20 minutes. Stand for 8 to 10 minutes. Walk for 2 to 3 minutes. Then sit again. This cycle keeps the calf muscle pump active, prevents sustained venous pooling in any single position, and maintains healthy venous return throughout the day. If you use a standing desk, never stand motionless for more than 30 minutes at a stretch. Set a timer on your phone or computer. When the timer goes off, walk. even if it is just a lap around your office or a trip to the water cooler and back. The walking activates your calf muscle pump and clears the pooled blood from your lower extremities. Standing in place and shifting your weight from foot to foot is better than standing completely still, but it is not a substitute for actual walking. Calf raises are a simple exercise you can perform at your standing desk that activates the muscle pump without requiring you to leave your workspace. Rise up onto the balls of your feet, hold for 2 seconds, and lower back down. Repeat 10 to 15 times every 30 minutes while standing. This simple movement contracts the gastrocnemius and soleus muscles, compressing the deep veins and pushing blood upward. Compression stockings deserve serious consideration for anyone who stands for extended periods, particularly seniors. Medical-grade graduated compression stockings apply external pressure that is greatest at the ankle and decreases progressively up the leg. This gradient pressure supports the venous valves, reduces vein diameter, increases blood flow velocity, and decreases venous pooling. Studies have consistently shown that compression stockings reduce leg symptoms, decrease ankle swelling, and slow the progression of chronic venous insufficiency in people who stand for prolonged periods. The compression level matters. Over-the-counter support hose typically provide 8 to 15 millimeters of mercury of compression, which offers mild support. Medical-grade stockings providing 20 to 30 millimeters of mercury offer substantially more benefit and are appropriate for people with existing venous insufficiency symptoms. Higher compression levels, 30 to 40 millimeters of mercury, may be recommended for people with significant varicose veins or a history of venous ulcers, but should be fitted under medical guidance. Elevating your legs above the level of your heart for 15 to 20 minutes several times throughout the day is another powerful strategy for reducing venous pressure and promoting venous return. This can be done during lunch breaks, while reading, or while watching television in the evening. The key is getting your feet above your heart. Simply putting your feet up on an ottoman while sitting in a chair provides some benefit, but lying down with your legs elevated on pillows provides much more effective gravitational drainage. Hydration plays a supporting role in venous health. Dehydration increases blood viscosity, making the blood thicker and more prone to sluggish flow and clot formation. Drinking adequate water throughout the day, 6 to 8 glasses for most adults, helps maintain the fluid balance that supports healthy blood flow. Exercise outside of work hours is crucial. Regular aerobic exercise, walking, swimming, cycling, strengthens the calf muscle pump, improves venous tone, reduces body weight, and decreases the overall risk of venous disease. The American Heart Association recommends at least 150 minutes per week of moderate intensity aerobic exercise, and this recommendation carries particular weight for people at risk of venous disease. Weight management is directly relevant because excess body weight increases intra-abdominal pressure, which compresses the large veins returning blood from the legs and increases venous pressure throughout the lower extremities. Every pound of excess weight adds to the hydrostatic burden on your leg veins. Maintaining a healthy body weight is one of the most effective strategies for preventing and managing chronic venous insufficiency. I want to address the specific concerns of seniors because aging itself is a risk factor for venous disease. The venous valves weaken with age. The vein walls lose elasticity and become more prone to dilation. The calf muscles atrophy and become less effective as venous pumps, and the prevalence of conditions that increase DVT risk, cancer, immobility, chronic illness, increases with age. For seniors, the recommendations I have outlined are not optional wellness tips. They are medical necessities for protecting vascular health. If you already have varicose veins, spider veins, or symptoms of chronic venous insufficiency, leg heaviness, aching, swelling, skin discoloration, or itching, see a vascular specialist for evaluation. Modern treatments for venous disease have evolved dramatically from the painful vein stripping surgery of decades past. Endovenous laser ablation, radiofrequency ablation, and ultrasound-guided foam sclerotherapy are minimally invasive procedures that can be performed in an office setting with local anesthesia, minimal downtime, and excellent outcomes. These treatments close the incompetent veins, redirect blood flow through healthy vessels, and can dramatically improve symptoms and prevent progression to more serious complications. The broader message I want you to take away from this is that the human body was designed for movement, not for sitting and not for standing. It was designed for the constant, varied, rhythmic physical activity that characterized human existence for millions of years before the invention of desks, chairs, and office buildings. The closest we can come to replicating that ancestral movement pattern in a modern work environment is to avoid staying in any single position for extended periods and to prioritize walking, the most fundamental human movement throughout the day. Your standing desk is not your enemy, but it is not your savior either. It is a tool that, used correctly as part of a sit-stand-walk cycle, can contribute to better health. Used incorrectly, as a license to stand motionless for hours, it can damage your veins, compromise your circulation, and create problems that will follow you for the rest of your life. Share this with everyone you know who uses a standing desk, and with every senior who stands for extended periods for any reason. Subscribe for more evidence-based health content designed to protect you from the dangers that hide in everyday habits. Drop a comment below telling me how many hours a day you stand and whether you have noticed any of the warning signs I described. Your engagement helps this reach the people who need it most. Move more, stand less, walk often. Your veins will thank you for the rest of your life. The role of footwear in venous health during prolonged standing is a practical concern that most people overlook entirely. High heels, which shorten the calf muscles and restrict ankle range of motion, significantly impair the calf muscle pump and should be avoided during standing desk use. Flat shoes with minimal cushioning can also be problematic because they transmit the full force of standing through the feet and legs without any shock absorption. The optimal footwear for standing desk use is a supportive shoe with a low heel, approximately 1 to 2 centimeters, that allows full ankle dorsiflexion and plantar flexion, enabling the calf muscles to contract through their complete range of motion. Anti-fatigue mats, which provide a slightly unstable surface that encourages subtle postural adjustments and micro-movements, can complement appropriate footwear by preventing the completely static standing posture that is most harmful to venous return. The hormonal dimension of venous disease is particularly relevant for women going through or past menopause. Estrogen and progesterone have significant effects on venous wall structure and function, and the decline in these hormones during menopause contributes to decreased venous tone, reduced valve competency, and increased susceptibility to venous dilation. This hormonal vulnerability means that postmenopausal women who stand for extended periods are at higher risk for developing varicose veins and chronic venous insufficiency compared to premenopausal women or men of the same age. Hormone replacement therapy may offer some protection for venous health, though this potential benefit must be weighed against the cardiovascular and oncological considerations that factor into hormone therapy decisions. Postmenopausal women who use standing desks should be especially attentive to the sit-stand-walk cycling recommendations and should consider compression stockings as a proactive measure rather than waiting for symptoms to develop. The connection between venous disease and quality of life in seniors deserves emphasis because the impact of chronic venous insufficiency extends far beyond the physical symptoms. Leg heaviness, aching, and swelling limit mobility, which reduces social engagement, physical activity, and independence. The visible disfigurement of severe varicose veins and skin changes can cause embarrassment and social withdrawal. Venous ulcers, when they develop, require intensive wound care that may involve multiple clinic visits per week, compression bandaging that restricts clothing choices and daily activities, and a psychological burden of managing a chronic wound that refuses to heal. Studies have shown that the quality of life impact of severe chronic venous insufficiency is comparable to that of congestive heart failure or chronic obstructive pulmonary disease, conditions that receive far more medical attention and public awareness. This disparity between the severity of the impact and the level of attention it receives means that many seniors with venous disease suffer in silence, accepting their symptoms as an inevitable part of aging rather than seeking the effective treatments that are available. I want to specifically address the phenomenon of occupational standing that many seniors encounter in retirement and volunteer activities. Seniors who work part-time in retail, who volunteer at hospitals or churches, who spend hours tending gardens while standing in one position, or who engage in hobbies like woodworking or cooking that involve prolonged static standing, are all exposing their veins to the same sustained hydrostatic pressure that damages the venous system during standing desk use. The principles I have outlined apply equally to these situations. Change position frequently, walk regularly, perform calf raises, wear compression stockings when standing for extended periods, and elevate your legs afterward. Many seniors are more physically active in retirement than they were during their working years, but the nature of that activity, standing rather than walking, may not provide the venous protection they assume it does. The emerging research on micro breaks and their impact on venous health provides encouraging evidence that even very brief interruptions in prolonged standing can provide meaningful vascular benefits. A study published in the Journal of Vascular Surgery found that walking for just 2 minutes after every 30 minutes of standing significantly reduced lower extremity venous pressure and decreased post-standing ankle swelling compared to continuous standing. Another study demonstrated that performing 10 calf raises every 20 minutes during standing reduced venous pooling by approximately 30% compared to standing without calf activation. These findings are encouraging because they suggest that venous protection does not require dramatic lifestyle changes or lengthy exercise sessions. It requires small, consistent movements integrated naturally into your standing routine. Setting a simple repeating timer and performing a brief walk or a set of calf raises, each time it sounds, is a minimal effort strategy with significant vascular benefits.